Health Education Lecture Series. All the listeners of Health Education Lecture Series, I am your host Gurdeep Singh Sandhu, homeopathic consultant. My phone number is 408-687-1899. Email address homeomedicine HOMEOMEDICINE @yahoo.com. Phone number 408-687-1899. Anytime when you are suffering from any disease at any age, please call me for your second opinion of your treatment as well as of the disease, and I will let you know what are the hurdles in your improvement. If there be any acquired type of reasons, yes, I can guide you about that one after doing a survey of your history. If there be any genetic problems, yes, I will guide you as well about that one so that you can take a proper action, proper treatment about that one. In my previous lectures, I have told you about this one that if there be anything concerned with the genetic characteristics, we can maintain that. We cannot cure them for permanently, but we can maintain that one. Now there are devices, there are medications, there are other means that we can manage those things which are related to the genetic sphere. But whatever, because most of the diseases are acquired diseases. Few of the diseases are from the genetic characters, and they start from the very beginning of the life in the mother's womb. And all other diseases, mostly they are acquired diseases because of our mistakes, because of our not following the normal natural law of living. We suffer from those things, and definitely there is a cure. There is a cure for all those things which are from the acquired source of causes. So in this way, one by one we are discussing all these things, and every time I am requesting you, if ever you are suffering from any disease at any age, you can call me for your second opinion. And if you want to take a homeopathic type of scientific approach to your health, yes, you can call me for that one, and I will guide you based on my 52 years of experience, out of which I taught about 26 years in medical colleges in India. And since I am here since 1996 September, since then I am teaching my community on radio, on TV, by newspapers, and everywhere. Since then I'm doing the same job, and was delivering lectures. There are thousands of lectures on YouTube, Facebook media, in newspapers, in various newspapers, uh, and radio stations. And now I have started a systematic study, a systematic how the life was created, how the life was developed, and then what type of hurdles the life faced during its course. And we are proceeding with that one, that now this body has been formed after birth. The body is increased to its maximum height, maximum whatever its development was. It has attained the same time, same thing in this body. And since then I started again the basic unit of this body, who made this body, that's known as the cell. And I describe you about the cell, that the cell is a type of fort which do not have any door. Very distinguishing things, very astonishing things, that a, a fort which is not having any door, but peoples are going in, coming out. People means the stuffs, whatever is, that is the protein, minerals, vitamins, everything, oxygen, everything is going into the fort, and everything is coming as a waste out of the cell. So this is what I started describing, and all the units, all the components of that cell I have described and their functions, what they do inside the body. And this body is made up of trillions of that kind of cells. Cells unites and they form the tissues, and the tissue is a similar type of group of cells. And there are different kinds of cell tissues, just like the connective tissues, just the nervous tissues, just the bone tissue, muscular tissues. All these things are the different types of tissues, and they are used for formation of this body. And after the formation of the body, we started what are the organs has been formed inside this body. And we started from the head, and I described that in the head there is a and that the skull was formed, and skull was formed with the seven different bones. And after that, 14 different bones were forming the face area. So total 21 bones are taking part in the total head, which includes the face as well. And inside this skull lies different organs: cerebrum, cerebellum, mons, medulla oblongata. And I have described each and every organ, where it is situated, what its function, what it do for the body. And after that, the vertebral column, we described about the vertebral column, which is united with the head. And vertebral column has canal and vertebrae, and there are different vertebrae. So everything I have described time to time, all the vertebrae, they are having individual characters. Just like the first vertebra is known as atlas vertebra, which unites with the skull. Vertebral column is united with the skull by the name of atlas vertebra, and the hole with which this is adjusted, that's a foramen magnum. So in this way, each and everything for the formation of this body I have described, and after that we started about the major important diseases of these organs. But it is not the detail, because the detail I will start later on. And when I will start the diseases, after that it will be again, uh, uh, every disease needs at least one lecture for me. So we will do with that one. But in general, I am discussing here that what is the organ name, what are the main important diseases it affected. And same way, after that, we came down from the skull and all this face area. And after that, we came to the neck, and we described about the neck. And after that, we came to the chest. This chest area includes also, again, like the brain, the chest area includes the major important organs of our body functioning. That these are the lungs and the heart. And in between the lungs, there is another area uh, which is known as mediastinum. And in this mediastinum lies this heart, and it is in between the central part of the chest. And it has been protected. Overall, it is protected by the rib cage, because these are the most important organs. And if the heart will stop for 3 to 5 minutes, it's very difficult to revise it again. The same way, stoppage of respiration and with the same limit, it's very difficult to revise it again. So in this way, these are the important organs in the chest area. And plus, there are some other trivial passengers, which blood vessels, food pipes, respiratory organs, all these are passing from upward to downward. It goes to the brain, just just like two carotid arteries, coming back as a superior vena cava. And in this way, the nervous junction that goes through the vertebral column and controls the whole body after getting out from the vertebral column at different regions. Just like the regions I described you, that there are cervical region that has two different you can say the seven vertebrae, and every vertebra has two holes. right side, left side, right side, left side. They control the upper arm, shoulder, girdle, and the whole arms. Their functioning, working, and everything is controlled by the cervical plexus. And after that, there is a thoracic area, and thoracic vertebrae are shedding off their roots, and they control the all chest organs in that one. And after that, there was a lumbar area which are having five lumbar vertebrae, and those lumbar vertebrae are containing nerves, and they are getting out from the lumbar vertebrae to control all the abdominal organs. In the same way, there was a sacral plexus, and the sacral plexus is also controlling the sacral area. That's the pelvic area organs, all the uterus, vaginal area, and all those areas, prostate in the males, and urinary bladder. All these things are controlled by this sacral plexus. So, in this way, everything I have told you systematically, that how this body was formed and what are the organs in a specific region, in a specific vertical region, just like in the skull, in the neck, in the chest. And now we are entering into the abdomen. And when we enter into the abdomen, I have described the abdomen into nine different sections. And out of those nine sections, I have described the three upper sections, that is the right hypochondric region, the left hypochondric region, and in between those there is epigastric regions. So epigastric region, so all the different three segments upward in the abdominal section, they contains various different organs. I described that what are the organs, what are the parts of the organs are in the right hypochondric region, what are the parts of the in epigastric area, they are situated in that area, and what are the organs situated in the left hypochondric regions, and what are their main functions. And if they fall sick, how we can recognize that the problem is located where, in which organs. And about that one, a general rule I told you, that the transmission of any pain, transmission of any complaint is towards the functioning route of the organs. The functioning route of the organ is just like the intestines, from mouth to anus, it has to go downward. Whatever is, if it's a normal cycle, is a controllable cycle, it may go downward. The pain will go peristaltic motions downward. And if it goes upward, it is a contrary thing, a very painful thing, just like the vomiting. Vomiting is not a simple thing. It's a very difficult because nature do not want that whatever has gone down should come up backward. That is known as regurgitation. Because when the food goes downward, when it steps down from mouth downward into the pharynx, from pharynx it passes the epiglottis and goes to the esophagus. From esophagus it passes the diaphragm, enters into the abdominal area. From the abdominal area it is attached to the stomach area, and that is cardiac orifice. And all these orifices are just the closers. You can say these are the closers. They close the openings. When anything goes inside, opening is closed. And then again, if there be any problem down there and the food wants to come out, or the nature wants that this food is not acceptable, it should go out anyway, the route furthermore up to the anus is too long. It may take long time, and till that maximum things, the toxic, the poisonous things will be absorbed by the system, it will be more dangerous. The nature itself try to evacuate as soon as possible, and there is only way that it should be vomiting out backward, regurgitations. And that regurgitation, though it's very difficult, as I told you, all the constriction, all the doors, all the openings are closed when the food goes downward. Then again, to open them on the contrary side, it's very difficult. That is why the vomiting is very difficult. So I have described all this one in the stomach area, and all other organs, omentum, greater sac, lesser sac of the omentum, head of the pancreas, and also the bile duct, and ampulla of Vater, duodenum. All these things I have described systematically. And if there be any pain, what are the signs and symptoms of those one in general. In general, I have given you an idea so that in the beginning, before going to the hospital, before going to the doctors, you yourself can judge that my complaint is concerned with this organ specifically, because its transmission is to this side and my pain goes to that this side. So in this way, it's very easy for you to understand that my complaints or my pain is concerned with this organ, particularly in this area. After that, we describe this one, the left hypochondriac area. In this left hypochondriac area, the major important organ I described was the spleen. And about the spleen, I told you it lies under the rib cage, remains over there if it's in normal conditions, but in case it is inflamed, it is increased in size because of its functioning, because of overloading, congestion of the blood circulations over there, it is enlarged. And then it may come up out from the ribs border, lower border of the ribs, where it is enclosed inside, it comes out. And this is the first and foremost sign for that one. If the spleen is palpated out of the ribs, means it's abnormal, it's not a normal. The normal position is inside the ribs. And after that, I told you about the spleen, that the main function of the spleen is to scrutinize these cells, blood cells, and also swallow, phagocytic function, swallow the dead cells, and to send it into the garbage which is going from the spleen outward to into the other cycles, and it is cleaned up in different organs, just like if there are salts, minerals, or there is a urea, or all these things, they are evacuated from the kidney. So in this way, this spleen is connected with the portal system as well. Splenic artery, splenic vein, and portal system drains the excess garbage from the spleen, and the portal system has attached to the liver. I told you that the every organ gets blood from the heart directly. Every organ sends blood back to the heart, but there is a difference. There is a difference that it carries the deoxygenated blood plus the garbage of the cell. Each and every cell, cell to cell, they join, they put their garbage into that one, and that drainage pipe becomes thickened. That content inside becomes thickened. And then to relieve that thickened, that closer, that blockage of the venous system, nature has set up another channel that is known as the lymph channels. And all these things are filtered into that one so that the venous circulation should continue, and this collection of the excess of garbage and all waste products from the cells are stored in a separate way, and they are transported to the lymph nodes. And the lymph nodes are the lymphatic organs, and the function of those is to swallow, to clean up. So whatever the cells are still normal, still able to work, still able to function inside the body and helpful for the body, they are cleaned up and again put up back into the systems. But those cells which are not recoverable, damaged with the garbage and with the all these toxic substances coming from the cells, then those cells are swallowed over there and put into the other cycles, so that goes into the garbage and cleaned up at different ways. So in this way, this is the function of the spleen. I told you about that one. And uh, spleen and liver, they are correlated with each other, because the garbage side which coming from the spleen in case if there is excess of garbage. We know, I told you about that one. The blood cells are formed in the long bones, and they are transported from the excretion, and that excretion means the venous circulations. The venous circulations from the bone goes to the spleen, and spleen check out those cells which are coming from the long bones, whether they are in a normal consistency or they are wrong, or they are not normal, they are sick or diseased or whatever it is. So it is scrutinizing all those things, and which are normal cells it sent to the circulations, but which are not normal cells it sends back again or swallow them, or ultimately they're again produced garbage. This function is producing the garbage, and that garbage goes to the portal system. And portal system, I told you that all the blood going from the anus upward to the from the intestines does not go directly to the heart, because it has maximum type of garbage contents coming from the spleen, coming from the intestines, coming from the rectum, coming from the anus, and all that one. So if it goes to the directly to the heart, and it will be distributed. Heart is a distributing center. It will distribute to the body, every cell, and every cell will be having the same type of garbage accumulation over there. Therefore, to protect that thing, this nature has set up a separate system known as the portal system. And I'm telling you about the spleen. The spleen sends its garbage. Garbage is the dead cells. Garbage is gases produced over there are sent into the portal system, and that portal system is united to the liver. And the liver take care of all those garbage and whatever it can do. Just like if the glucose is there, it is stored into the sugar means. Sugar is controlled in the liver as a glycogen. And whenever, suppose, if you are fasting, you are not taking food, and since many days you are not taking food, ultimately this body, for the survival of each and every cell, needs heat, needs calories, and 1700 calories are normally required by the cells to continue its normal function throughout the body. But if you are not eating food, then how this will be generated? This heat will not be generated. In this way, the stored glycogen in the liver, stored fat in the various areas of the body, they are recycled. They are recycled and put into circulations, goes to the portal system, and the portal system goes to the liver, and the liver again check it and send it back to the circulation via a zygous vein, and that goes to the blood, and then it is circulated throughout the body. But suppose if it's normal, or if the garbage has been removed, if the garbage has been swallowed up, that is the phagocytic function of the lymph system all over the body. But if still that garbage is coming regularly in excess time to time, just like in case of cancer, just like in case of lupus, just like case of all the malignant type of things, the garbage is produced regularly, and garbage is increasing time to time. Under those conditions, this is occupied more of the garbage, and then ultimately there is no way out that the liver can stop that one. No, it has to send it back, and that goes to the circulation, and blood is a transporting media. It transported everywhere into the cells, and ultimately that's why the people say it's a malignant means metastasis. Metastasis means the disease had spread to the other organs from the organ of its origin, source organ. Suppose there is a cancer has developed in the uterus. From the uterus, first of all, the local lymph nodes will be swelled up, and ultimately they will try to clean up the bloods. But if not, then it will go to the again circulating to the spleen, and spleen will try to clean up all these things, and ultimately under these conditions sometimes the spleen is enlarged because of the overwork, because of the overload coming the garbage from the cancerous side of things. And ultimately, in these conditions, when all this route is filled up, there is no other way that this is spreading to the whole body, and lymph nodes in all the areas are developed, and then we say it is metastasis, means the disease from one or origin, from the one organ, from one source has spread to the other organs and other sources. So this is a difficult type of thing. So we are talking about the left hypochondric area, and I told you about that one, that the lymph left hypochondric area contains the spleen, that important organ of the reticuloendothelial systems, organ of cleaning the body. In general way, you can say that it cleans the blood and swallow the dead cells. When it swallows the dead cell, it means garbage is produced. When the garbage is produced, spleen send this garbage to the portal system, via the portal vein, and then it goes to the liver. So in this way, collaboration of different organs with each other, this body is running its normal functions, and they try to control the infection of one organ so that it should not go to the other organs. But ultimately, when it is beyond their limit to control, ultimately it spreads up. It spreads up in the whole body, and that disease becomes more difficult to be cured. So, this organ lies in the left hypochondric area. Under this spleen area, there is a transverse colon of the large intestines, and there is a splenic flexor where this large intestine turns downward, and the portion of the descending colon is also lying in this left hypochondric areas. The next thing I told you, that the back of the stomach plus the head of the pancreas, all these are lying in this area. And the pancreas itself, it's organ which controls the sugar metabolism, means it controls the excess of sugar, it controls the less sugar. Ultimately, under conditions when you are starving, when you are not eating food, this is the organ which takes uh, accumulated food, deposited food from the other organs, and put it into the circulations. For increasing sugar, for decreasing sugar, this insulin works over there. And this is the organ which is situated in the left hypochondriac area. And if there be any problem in the left hypochondriac area, I told you the pain goes towards the backside. When pain goes to the backside, it's not directly over there. It is starting from the mid side of the epigastric area and goes downward to the backside. This is the area of the pancreas, but sometimes it may be confused with the kidney pains. But when I was discussing about the lumbar area, I told you the kidney pain mostly starts from the back side of the lumbar area and goes towards the uterus downward up to the urethra, where there is a transmission of this one. From the kidney, urine is filtered, cleaned blood is sent back to the circulation. The garbage in the shape of urine is sent back to the bladder via the ureter, then from the bladder to the urethra. So the pain concerned with the kidney ultimately goes downward. Where are the kidneys? Kidneys are in the backside of our lumbar area. Where there is a lumbar area, the backside of the lumbar area has the position of the kidney. From there, the ureter are released. If there be any problem, that ureter transports the urine and minerals and whatever is excess inside the blood, they are filtered and sent back to the urinary bladder. and the pain will be suppose if there is a big stone, and stone will move very slowly with the pressure, with the peristaltic motions, and ultimately as that stone will move, it will cause pain, it will cause pain. And ultimately when from the nephrons, they are the function unit of the kidney, from the nephron a crystal of the stone or a part of the stone reaches up to the hilum of the kidney once the pain is relieved. And after that, when it starts going downward in the ureter, pain again starts. And that pain is a crucial pain which goes downward. The transmission of the pain is from this area to downward. Kidney is backside. It means the pain from the backside goes into front of the abdomen, then goes to the downward toward the urinary bladder. And where the urinary bladder is lying, where you put the belt and there is a buckle of your pant, at that position is the bladder. When it is filled up, we can trace it above the symphysis pubis, this bone where your buckle is. Or if it's not filled, it's empty, it is downward, we cannot palpate it. So in this way, this is the transmission of that one. So, kidney, about the kidney, I told you in the lumbar area that right kidney is a little bit lower than the left kidney, because inside the right hypochondric area there is a liver, it's a big organ, plus there is a downward hanging down the gallbladder. So it covers the more part of the hypochondric area, right hypochondric area. That is why the right kidney is little bit lower than the left, because on left side the spleen is a smaller organs, and it covers a little portions under the ribs. That is why the left kidney is a little bit higher in position from the right kidney. So these are the conditions in that one. The other thing, in this left hypochondric area, because we are describing the spleen, so I started the lower lumbar area first. So in this area, above the kidney, above the kidney, there lies a descending colon of the large intestine, because from spleen, from right hypochondria, spleen, this intestine is going downward, taking the food stuff and the stool and whatever has been the wastage from the food is going downward towards the sigmoid colon, rectum, and anus to be evacuated from the body. So in this way, that portion that is known as descending colon of the large intestine, that lies in the lumbar area as well. In this way, if there is a pain in the large intestine, maybe constipation and all that, and if there is a gas formation, sometimes left hypochondric area is filled up with gas, and pain is transmitted from downward to upward. If there is a constipation, we feel pain and we feel hardness in the descending colon of the large intestines. And mostly the transmission of the pain, because the route of the large intestine is downward. Gas is not the normal contents of that one. Gas should not be formed. Stool should formed and it should go downward. The transmission of the stool from the large intestine is towards down. And if there be any pain in the large intestine, the pain will transmit towards the downside. But if there is a gas, because of that, the gas has its own nature. It does not go normally to the downside, it goes upward. In this way, the distension in the left hypochondric area, we can see that. Other things, there is a glands that is known as suprarenal gland, or the other name is adrenaline gland. These are two kidneys, one on right side in the lumbar area, one in the left side of the lumbar area, and both the kidneys are having two glands at their top pole, upper pole, upper pole of the kidney. Just the kidneys are like bean shape, like bean shape, and just like rajma, you can say that in this way, but they are bigger in size. I will tell you, explain you everything, measurement and everything, and internal structures when I will come to the kidney. To describe only the kidney, that will take one complete lecture. So that's why I'm telling, I'm just giving this introductory lectures of the abdomen, of the different area and the organs inside that one, and what are the major important problems and how their pains are transmitting. This is what I'm describing here. But in detail of the kidney, detail of ureter, detail of bladder, all these things will be taking one lecture each. So let's come to this one. So above both kidney, there lies a gland which is a triangular type of shape gland, that is known as adrenaline gland. And adrenaline gland is a part of our endocrine system, and endocrine systems are the igniting type of thing, just like burning, just like the matchbox. I described many times in these vectors. The major function of the endocrine glands, these endocrine glands are scattered all over the body, and whatever they produce as a garbage, basically this is garbage. Two type of garbage is released from this kind of organs. One, blood is coming, the arterial blood is coming, which is bringing food, oxygen, everything for the cells. And the other is a venous structure which sends outward the remaining portion of the blood, deoxygenated blood, and the garbage of the cell. Plus, I am saying, in this back going blood, in this deoxygenated blood, which is going back from the endocrine gland or endocrine systems in this way, it contains the garbage of that gland, and that garbage is known as hormones. Just like honeybee, they produce honey. Honey is the wastage of the honeybee, but it's a food for us. We use it. The same way, endocrine glands are secreting. They are not basically they are excreting, but it is not going out of the body. Their excretion is used by the body for different other functions. In this way, every organ's excretion has hormones, which is transported back with the blood, with the venous blood. And then that venous blood has hormones, and they are circulating throughout the body. Different endocrine glands, just like pituitary gland, thyroid gland, yeah, this one, the adrenaline gland on the kidneys. There are various other glands, endocrine glands, and whatever they produce as a garbage, that is known as hormones. And the function of these hormone is to ignite, to give heat, to burn it out, just like the matchbox does. In the same way, when they send their garbage, they send their hormone as well as a waste product of that organ. And the different gland of the endocrine system produces different hormones, and these different hormones continuously continue circulating throughout the blood. And wherever any organ needs those hormones for their normal function or to ignite or to stimulate their function, they take it from the circulations and use it to fire their own energy. For example, TSH is produced by the pituitary gland, goes to the thyroid stimulating hormones. That stimulates the thyroid gland. Relatively, thyroid gland has its own function, T3, T4, and many other hormones, thyroxine. All these things are produced by the thyroid gland. And they are also circulating inside the blood and doing their own functions. Just like the main, this organ, thyroid gland, is concerned with the metabolic rates, obesity or thinning of the body, slimming of the body, marasmus, all these things. They are all concerned with the thyroid hormones. It is circulating throughout the blood. Just like a person who is selling vegetables, he goes to the streets. He is carrying different kind of vegetables, different kind of products which we need daily in our kitchen. But not all these stuffs we need daily. Alternatively, we need different kind of things. In this way, one organ, whatever hormone it is producing, it is shed off into the back going blood, that is the venous blood. This is his garbage, and it is circulating into the general circulations. And when it reaches to individual organs, and that individual organ needs that one for its own functions, that take it up from the circulations. In this way, I told you TSH, for example, it is released by the pituitary gland, and that hormone goes to the circulation, and ultimately, when that circulation reaches to the thyroid gland, it takes up for its function. And also, it goes to the testis in the male side. And by its function, by its help, you can say, testosterone hormone is produced by the testis. Same way, the same hormone in the females goes to the ovary to produce estrogen hormones, and in this way goes to the uterus, make a placenta or all other things to produce progesterone hormone. Next function of the progesterone hormone. It goes to the corpus luteum. When the ovum is out from the ovary, the remaining portion of the ovary is known as corpus luteum. And that corpus luteum produces the prolutone, that's the progesterone. It cannot produce progesterone unless it is helped by the pituitary hormone, follicular stimulating hormone. Okay, LH hormone, luteinizing hormone, and follicular stimulating hormones, they act on the ovary, they act on the testis, and by their action, testis in the male, ovary in the female starts their function and produce different other organs for the different functions, just like the progesterone, estrogens are necessary for the production of the menstruation as well as for the pregnancy. The same way, the same hormone is produced in the testis, and they produce the spermatozoas, and ultimately, relatively, the spermatozoa comes out for the pregnancy, and that has been already described. So, in this way, all the hormones are liberated, transported via the back going blood from them, reaches into the circulations, and taken up by the other organs whosoever need that hormone. And their function is to stimulate the functioning of the other organs. Though it's a garbage. It's a garbage for one organ, for one gland, but it is useful for the other. In this way, I'm talking about the lumbar area, and I'm talking about the adrenaline gland. The glands are, this is also known as suprarenal gland. Supra means above, and renal means kidney. Above the kidney, on both sides, on right and left kidney, that gland lies known as adrenaline gland or suprarenal gland. And adrenaline hormone is produced, cortisol is produced by this organ. The main function of this hormone is, I will tell you the detail later on. I'm just focusing on the main functions: fear, sadness, sorrow, grief, you can say disappointments. All these things are concerned with this hormone. If this hormone is not normally produced and not normally circulating into the circulating blood, ultimately it will not be taken up by the other organs, and all the organs will be depressed. All the organ will not be able to function normally. Strong, bold, everything will be lost. So when you see any depressed person, sad person, with sorrow, with grief, and all that one, you can well imagine that his adrenaline gland is not producing the normal hormone. That is why he is depressed. There are other many diseases. I will tell you, it's just an indication. I'm just giving you the indications. But when I will talk about the adrenaline gland, you will be astonished how many functions it has, what it can go, how the body structure is changed. With the adrenaline gland hormone function, a body structure is changed. So all these things I will tell you later on. Just like many times, if the adrenaline gland is not working normally, most of the people suffer from hypertension, blood pressure. So it will come up detail when I go to the adrenaline gland. It will come up there that it's also its function to control the blood circulations and control the blood pressure as well. So in this way, we are passing through the lumbar area, and especially the left side of lumbar area. I calculated the kidneys, suprarenal gland, descending colon of the large intestines. Plus, there are more important nerves which are passing through which are controlling the function of the kidney, and some of the muscles which are more important here. With the abnormality of these muscles, kidney function may be disturbed. Kidney function may be disturbed, and it may bring up pain or other associated symptoms we'll describe you later. The one is quadratus lumbrum. Quadratus, which has four heads. Lumbrum in the lumbar area. Lumbar area, there is a muscle which has four type of origins, and it controls the you can say the bed for the kidney. It makes a bed for the kidney in the backside where this kidney is lying. And the other muscle which is more important in this area is the psoas major muscle. This psoas major muscle is mainly the muscle of hip bone, but it also takes part in the lumbar area as well. And I told you in lumbar area there is a kidney, important organs. So it means with quadratus lumbarum and the psoas major muscle, the bed for the kidney is prepared, and the kidney is situated in that area. So ultimately, this lumbar area has big importance things for this body. Come to the right side of the kidney. The right side of the kidney, just like the large intestine, starts from the right cecal valve, the right side of above the inguinal area, above just like when you divided the abdomen into nine different parts, we draw a line that is transtubercle plane from tubercle to tubercle. Tubercle, whose tubercle? Ilium crest. The iliac crest, the highest bone in our hip bone, where we put the belt, that is the iliac crest, iliac, iliac bone's crest. And on that there is a tubercle. From tubercle to tubercle, we draw a plan, a line. Above that line, on right side in this inguinal area, below the lumbar area, there is a section that is known as a cecal valve. That cecal valve is the junction of small intestine with the large intestine. Why valve? Because when the food enters into the intestine, it is dissolved by the and different type of enzymes throughout its course, just like in the stomach, just like you can start it from the mouth. When we take food in the mouth and the carbohydrate starts dissolving over here by the pepsin, ptyalin, not pepsin, sorry, ptyalin. Ptyalin is produced inside the mouth, and carbohydrates start dissolving from here, goes downward. When it goes to the stomach, there is a HCl, there is a pepsin. So gastric juices as a whole, we can say that they are dissolved into the food. Ultimately, food goes from the intestines. Then in the first portion of the small intestine, there is a duodenum, bile is mixed into it. Pancreatic juice, that is the insulin that is mixed into it. Again, it goes to the small intestine, that's the second part, that is jejunum, that also producing the enterokinase and other enzymes. So ultimately, when this food reaches up to the right side, the end of the ileum, the small portion's end is the ileum, that becomes a thin tail. And till that, this food is converted into purely liquid form. All the contents, whatever we have taken, eaten, whatever, they are converted into liquid by dissolving all these enzymes, and they are dissolving everything. And ultimately, with the peristaltic motions like this, just like the motion of the earthworm, this liquid food materials is jumping up into the large intestine, first portion of the large intestine, and that is the ascending colon, that is known as ascending, going upward. Large intestine is made up of colons and flexors, colons and flexors. Okay, so in this way, large intestine starts from this area on the right side above the inguinal ligament, and that valve is functioning with the peristaltic motions. With the peristaltic motion, the liquid converted food goes upward into the intestines. Then it shut down, goes upward with the peristaltic motion of the large intestines. And then at the junction of the small intestine with the large intestine, there is still 1.5 inch or about 2 inches a long thread like earthworm type things that is known as appendix. And appendix, the food, sometimes the liquid food goes, it has hole inside, goes inside the appendix, comes back from the intestine, goes inside the appendix, come in backside into the stream, and ultimately it is time to time going to the large intestine by jumping movements by the peristaltic motions. This is known as peristaltic motions. So in this way, this food is going forward. And That area is of very important area because in this area lies the appendix, and everybody knows about that, the appendicitis. The appendicitis was a worst type of disease, was killing many of the persons before that, before the invention of the antibiotics, before the invention of various other strong medications to subside the inflammations. People were dying, and even we were not knowing about that one. What's the reason behind that? Ultimately, now we know that the inflammation, because the stuff is going inside the appendix, coming back. Like, what if something solid has gone over there, is not coming back, and it causes fermentation inside? Residual portion of the stool remains inside, it causes fermentation, it is inflamed, and all that happens after that causes severe pain. But because it is part of the small intestines, and when there will be pain, there will be inflammation of the appendicitis, the pain will goes to the umbilicus area. As I told you, that the small intestine is curling around the umbilicus, just like a snake. It's around the umbilical area, and the pain is in the appendix. That is the portion of the small intestine, outward portion of the small intestines, and that is why the transmission wise, this pain goes to that one, backward, backward flow. So it goes to the intestine, umbilical area, and also it produces vomiting, because the normal transmission is that it should come up and go into large intestine, but it is not going to the large intestine. It is somewhere blocked into the appendix, and when it is blocked to the appendix, ultimately it inflamed. It causes problems over there. And then there is a backward, not upward, because upward is a valve. Upward is a valve, and that valve is opening only on one side. Stool goes into the large intestine, and ultimately, where will pain go? Pain will go to the backward, and that backward is surrounding the umbilical area. So pain will go to the umbilical area. And also this regurgitation, this backward flow will cause the vomiting as well. So these are normally two major important symptoms. Pain starts in the right inguinal area, above the inguinal area. Pain goes backward to the umbilical area. Pain is associated with the vomiting and fever. So all these symptoms are the of the appendicitis or appendix problems. And then on the right lumbar area, there is a ascending colon of the large intestine. Today, I'm seeing that I cannot complete this right renal area. I will describe it tomorrow, and my time is over today. So tomorrow we will discuss the right renal area or right lumbar area. What are other organs? What are the other problems in this area, and what is the transmission of a pain of this area? I will describe again. Okay, so I'm your host, Gurdeep Singh Sandhu, homeopathic consultant. My clinic address is 9701 Sarah and Court, Dublin, California 94568. Phone number 408 687 1899. Anytime when you are suffering from any disease at any age and you are not getting well, there is some hurdles in the way of improving your health, you can call me for your second opinion. And if ever you want to get a homeopathic specific type of treatments, you can call me at 408 687 1899. God bless you all. We'll see you tomorrow. Again, please, if you see some improvement, if you see some knowledge is getting, you are getting through these lectures, convey this message to all other nearest and dearest so that they can join me on Facebook as a friend. They can join my YouTube channel, Health Education Lecture Series by Gurdeep Singh Sandhu. or they can download the app of Sabarang radio station, sabarangstation.com, www.sabarangstation.com, and they can listen many more various programs, which is 24-hour radio stations. Day and night there are entertainment programs, Gurbani, Bhajan, Filmi Sangeet, Punjabi Filmi Sangeets, all these things there is, and in between there are skits, entertainment skits. And every evening from 5 to 6 p.m., I come to your society, and then I deliver this health education lecture at that time, and you can listen me that one. So, Rabaraka, God bless you. We'll see you tomorrow for another lecture of right lumbar area. Thank you.